There's a controversial bill heading to the Idaho Senate floor right now to outlaw gender-affirming health care for minors. The Idaho House of Representatives voted Tuesday in favor of House Bill 71.
If passed, it would make it a felony for physicians to provide hormone blockers, hormone treatment, or gender-affirming surgeries to transgender youth. Peter Choice shares concerns from the LGBTQ community and pediatricians.
I spoke to Kimber London, who is a non-binary activist living in North Idaho. London believes gender-affirming care saves lives, and taking the care away from children could raise suicide rates higher than ever.
There's no excuse for ignorance. The American Medical Association, all of these institutions are coming out and saying gender-affirming care is a positive thing and it saves lives.
London tells me criminalizing gender-affirming medical care would restrict what doctors believe is right for patients.
We need to stop putting pressure on our medical providers with jail time for performing certain procedures. I think the biggest question that we all need to address as a society is, do we need to get involved in what families decide is right for themselves, between themselves and their healthcare provider?
In terms of the medical treatment, this care is life-saving.
Because she says transgender youth are in much higher risk of depression and suicidal thoughts right now.
Hence, when they receive evidence-based gender-affirming care, their odds risk of depression goes down by 60%-ish, and of suicide goes down by almost 75%.
If this bill passes, you could lose some patients.
Yeah, I mean, I'm worried about losing them to suicide for sure. Suicide is the third leading killer of kids, of adolescents and young adults, and the second leading killer of young adolescents aged 10 to 14.
She says this care is a long and slow procedure in which doctors conduct mental health assessments before they provide medical treatment.
Therapy, psychological assessment, and then social transition before we look at medication. You can't just walk into a physician's office and come out with a prescription.
If passed, Idaho will be the next state, followed by South Dakota and Utah, to ban gender-affirming care for transgender minors. We reach out to Senate lawmakers who will consider the bill for comment but have not heard back. And no word yet on when the Senate plans to vote. In studio tonight, Peter Choi, 4 News Now.
Peter, thank you.